You might be wondering, how do you take a prednisone dose pack? Hi, I'm Dr. Megan, your prednisone pharmacist, and I'm here to explain exactly how to take a prednisone dose pack. So typically, prednisone is prescribed in a bottle like this one, and the pharmacist dumps it out and puts it in a pill bottle. But in your case, you have a dose pack, and you probably are punching it out into little holes. And so if you have a dose pack, this is what it likely has. It either has prednisone 20 milligram tablets in it, or it has prednisone 10 milligram tablets in it. It depends. Those are two options of how it could be provided. And if that's how it is, what you're going to do is you take it all at once, first thing in the morning. So on day one, you punch out all 6 tablets on the first day and you put them in your hand. You swallow it with a tall glass of water, hopefully some food as well. And that's what you do on the first day. Don't spread them out throughout the day, as it can cause more side effects like insomnia if you take it closer to bedtime. You want it first thing in the morning if possible. But if you just picked it up from the pharmacy, say at noon, then take that first dose at noon. Then the next day for day 2, you're going to punch out all 5 tablets and you're going to put them in your mouth, swallow with a tall glass of water. And then on day 3, you're going to have 4 tablets and you're going to punch them all out all at once, swallow them. On day 4, you're going to have 3 tablets, punch out all 3, swallow them. Day 5, you're going to have 2 tablets, punch out both of them, swallow them first thing in the morning. And on last day, day 6, you'll have 1 tablet, punch that one out, swallow it first thing in the morning. You can take it with or without food. Generally, it's recommended to be taken with food. And you'll be going on day 1 with 6 tablets. And if you are getting the 10 milligram prednisone dose pack, then you have 60 milligrams on day 1. And then it's 50 milligrams on day 2, 40 milligrams on day 3, 30 milligrams on day 4, 20 milligrams on day 5, and 10 milligrams on day 6. And you're just dropping down. And that's called a taper. And that's what's best to do when it comes to taking prednisone, because your body needs time to recover, to go slowly off, so you don't go into what's called an adrenal crisis. That is terrible. It can actually be fatal if you go straight from one dose to another without slowly tapering off. And if you've taken just one day, it may be okay to go off completely, but you definitely have to check with your doctor. Going beyond 5 days and definitely beyond 10 to 14 days, you must taper. There are no exceptions. Going cold turkey can literally be fatal. So if you're just taking the prednisone dose pack, the 6 days worth, you can just follow that taper plan and it should be just right for you. But what if it's not? What if you stop taking it and you feel awful? You feel exhausted, have a hard time getting off the couch, you're miserable? Then tell your doctor, be in touch, because you might be going through withdrawals. And most people are fine doing just that 6-day taper, but a small percentage of people need a more prolonged taper to help your adrenal system to recover. And if you are looking to counteract the side effects of this short 6-day prednisone dose pack taper, then check out my prednisone checklist. You can download it by clicking the link below. And in it, I have my tips for how to counteract the top side effects that happen while you're taking prednisone. And that way you can feel your very best, even though you're taking this drug that is not fun. Signing off as Dr. Megan, your prednisone pharmacist.